What I usually explain to patients is when you think about palliative care is actually an umbrella. And we belong to the profession that provides care for patients who have serious illness, no matter where they are in their illness. And the goal of a palliative care team is to provide support for the physical, spiritual, and psychological symptoms, as well as social distress that accompanies people when they are going through a serious illness. It's provided along with curative. It can be provided along with curative therapy. And we serve as an extra layer of support for patients and their providers to help shore up the treatment plan. How that differs from hospice. Well, I explained that not all hospice, all hospice is palliative care, but not all palliative care is hospice. So hospice is the vehicle that we use to deliver palliative care when patients are approaching what we are concerned is at the end of life.
Can you, Dr. Christine, explain a little bit about who is eligible for palliative care? And for those in particular who are metastatic, what is the kind of typical scenario when palliative care is considered, and what is ideal in beginning palliative care?
Well, I don't know how many of you guys have heard of ASCO, but ASCO is the magical fairy place that all of your oncologists go each year and you can't get in touch with them. They're at ASCO if you wanted to. Where's my doctor? But that's the large organization that puts out guidelines and where your oncologists go to learn, exchange information all the day. This is where, the big things happen. And their recent set of guidelines said that any patient who has advanced stage cancer should have access to interprofessional specialty palliative care team. So that is now become the standard of care in cancer. So if you have metastatic breast cancer, by definition, you should be allowed to have access to interprofessional palliative care team. So that's very easy if you are in large cities or if you're in places that have interprofessional palliative care teams subsidized by big, large places. So for places that have smaller, what you might find is you have your palliative care, they may not call it that, but the social worker that you're talking to, the nutritionist, they sort of cobble together what I like to call primary palliative care. So if you're with your team and they're discussing what your goals are, they're discussing what your wishes are, you're with advanced practice provider or physician that does that with you, they are providing palliative care. They're just providing it primarily. And when they bring their social worker in or other supportive services, that's providing supportive oncology. That's a form of palliative care for places. So that's one way to kind of access it. We kind of cobble it together. When your issues are outweighing, like the majority of the appointment is really focused on your symptoms and they can't really get to helping you sort of navigate what to do with your cancer, that's when your providers, that's usually the trigger that they have to say, let me get help with this. Let me, this needs more time. I need more time to talk about your pain, or they'll say, I don't have the expertise in this, particularly around sometimes pain and symptom management. They've tried all the things that they know to try. They're thinking about maybe using medications that have a little more side effect, and they're wanting you to have the best care possible. So they may send you to a palliative care team because all we do is live in that world. Like our chemotherapy is our symptom management. So that's when many providers will ask for our help. Or if they realize that the resources or the social supports are a little frayed or they've become strained, they'll ask us to step in at that moment. But according to the guidelines set up by the people your oncologists listen to, you should have access. One universal resource that you can use, and that would be great if it was promoted, is getpalliativecare.org. And that can usually give you an idea of what providers are in your area.